Hi, my name is Eric Chipman. I'm a physical therapist here at Mertru Medical Center. I've been here since 2008. I'm here to talk today a little bit about risk injury assessment. One of the things that people ask a lot in our profession is, what is my risk of getting injured? Or if I am injured, what is my risk of being re-injured? Or a big one is, when can I return back to my activities, whether that be sports, work, daily life. So in regards to risk of injury, when you're talking about when I can return back to sports or when I can go back to whatever it is, work, medicine has up on physical therapy. And the fact that in medicine that you have standard risk factors that are present that most all doctors agree upon and are used in their practices, like blood pressure, blood sugars, body mass index or BMI, or age or weight, those types of things. In physical therapy, standardized risk factors are seldom agreed upon and not very commonly used until recently. Not all the time, but a lot of time in physical therapy, people will go by their past history with certain types of patients, certain types of injuries, and their results from those activities that they're doing in their rehab. There's been more and more of a push in the physical therapy realm to make your treatments evidence-based, meaning that your treatment is based off of research that has been done by other people that has been proven to work. So that brings us to talk about functional movement systems. Physical therapy now has a tool that is standardized that we have not had in the past that we can now use to help people in assessing their risk factors and what their risk of injury can be. The FMS system comprises of two different types of assessments. One is called the Functional Movement Screen, or FMS. The other is called the Y-Balance. So how is it these tools can be effective? Well, if you look back to training during World War II military, there was a type of pose that they used to stabilize the shooter so that he could get an accurate shot. My guess is that most of the people in our community today could not reenact this same position. There's a quote that I really like that says, "Is that bad movement, or have we become bad squatters?" And that can be said for many individuals, whether you're a high school athlete, whether you're a weekend warrior, whether you're somebody who's 70 years old out on the golf course. There's multiple things that we can look at to see whether or not you're at risk for injury. So this is where we come to the FMS screen. It's made of 7 movements which involve squatting, stepping, lunging, reaching, leg raising, a push-up, and rotary stability. These movements are based on developmental patterns that we had as we grew up. Most people had them, and we want to continue them through a person's lifespan. For example, if you look at most 1 or 2-year-olds, they're going to be able to squat pretty well. If you go to a third world country that doesn't have plumbing, they're going to be able to squat pretty well. How many people can squat like the child in this first picture? And if you move to adolescence, is this a kid that you want to load with a lot of weight to do squats? And then as you move further, this is a correct posture where we want somebody to be able to be loaded with weight that are going to be reduced for injury. And then why is it as we get older, we lose that ability? So why is it when we're younger, we have the ability, then we lose it, then we gain it, and then we lose it again? So that's one of the things that we look at in risk factors is this person set up for success? Do we want to exercise them in a dysfunction, or do we want to exercise them in a correct pattern? Another tool that we use is called the Y-Balance. It uses 6 different types of movements based on single leg stance and upper extremity single arm stances. And that has also been researched greatly into helping us figure out what risk factors are involved in somebody getting injured. So what is it that increases our risk of injury in movement or activity? Most important is previous injury. The second is asymmetry in movement. So movement on one side of the body is different than movement on the other. The next is body mass index, or BMI. And the last one is stupidity, because we all do certain things that maybe aren't the smartest things in the world, and that spans all ages. So if we go back to what predisposes somebody to injury, previous injury, asymmetry, BMI, or stupidity, we look in the FMS for certain asymmetries. We want to make sure that your left side is similar to your right side. And what they found is that as those asymmetries show themselves, they have become very good predictors of how injured somebody could be in an activity they're going to be involved in. In fact, there was a study where they used an NFL team that if you did not score a certain percentage, that player was at a 50% increase of risk of injury. So this is why we like having these tools, because we're able to better use our information to more definitively tell somebody that they're either at a substantial risk of injury, they're at a moderate risk of injury, they're passable, or they're at the optimal level we want them to be. Now, lightning always can strike, but this is the best tools we have to date to be able to do this for somebody, versus just going based off of our previous history, what we think, and what we guess. On top of this, Functional Movement Systems has a website and a program called Move to Perform. We can take all of this information from the FMS, from the Y-Balance, and put this into the computer program. That computer program compares the scores of the individual being tested against all the other individuals that have ever been tested that have been entered into this particular program. So this is a great tool that we can use to say to the patient, see this score here? This compares you to every other person your age and in your sport that's taken this test. And this is where you line up, and this is your risk of injury. Again, it's a great tool that we have. We have 2 people certified in it, and we have multiple individuals that have been trained to give the tests. And it's just one more piece of the puzzle that we can add to our practice to better help the community.